Over 100,000 children and youth are in the U.S. foster care system, awaiting adoptive families. The number of children waiting is a national child welfare crisis, and 30,000 or more are 18-year-olds who are aging out of the system each year. Adopt America Network, also known as AAN, was created to help waiting children find permanent families. For 30 years, AAN has been working with public and private agencies to connect these children with adoptive families around the country. The children are primarily of school age, have one or more siblings, and have medical or emotional challenges. It's not their fault that they have problems, and it's surely not their fault that they don't have a home. It's been our passion and mission to provide services to families who are willing to adopt special needs children from foster care. Bringing children and families together is what we do. We believe every child is adoptable, and we will not rest until every child has a family. Adopt America has directly placed 4,000 children with adoptive families and has provided matching services to tens of thousands more children. Our first objective is to bring even more children and families together, particularly those children who have medical and mental health issues and those with siblings. There are major efforts underway to recruit families on both a national level, funded by the Department of Health and Human Services, and locally as counties advertise on billboards, radio, and television. AAN strives to work with the families and the children's caseworkers to keep families motivated and moving forward, and to keep caseworkers aware of the supportive services we provide to help them match their children. We want to reach out to the families and provide them with excellent matching services, relentlessly pursuing an appropriate match for them. And we want to reach out to children's caseworkers and provide them with the training and tools they need to match their children with available families. Adopt America is the largest agency of its kind in the country. As a nimble, well-respected, proactive organization, AAN has the ability to work behind the scenes and partner with public and private agencies to get work done. We're known for our tenacity. Families thank us for going to bat for them and helping them navigate the complex and lengthy adoption process. Adopt America uses a national network of private and public agencies and experienced adoptive families to connect and support children and prospective adoptive parents. We've placed children from every state with families across the country. Partnerships with family servicing agencies allow us to connect families with the social work services they need to be trained and assessed in preparation for adoption. Working relationships with the public child welfare agencies give caseworkers access to eager, prepared families and allows AAN to share the children's information with families around the country. This network, connected by email, Twitter, Facebook, blogs, and the telephone, is bringing like-minded and motivated people from across the country together on behalf of the kids who wait. AAN offers training to public agencies across the country to assist them in their work to find families who are prepared to adopt children from foster care. We have numerous sessions, including The Myths of Matching and The Art and Science of Matching. These sessions help workers and supervisors open their thinking regarding family screening and selection, as well as increasing their skills at reviewing home study assessments. In the mid-2000s, Adopt America launched our Family Child Electronic Matching Program database, Easy Match. The program was developed expressly for AAN, with adoption matching as its purpose. The system matches on 4 main characteristics: age, race, gender, and number of siblings. And then it further matches on 60 medical, developmental, and behavioral challenges. The resulting matches become the launching point for our staff and volunteers to unite the families and children. Adopt America demonstrates success through programmatic outcome data. For families, AAN tracks the number of new families recruited, the source of each new family, the number of referrals to children's caseworkers, staffings for children, matches, placements, and disruptions. Similarly, we track the number of children registered into our database, referrals to families for consideration, matches, placements, characteristics of the placed children, and disruptions. Additionally, we track outcomes from training programs, recruitment strategies, and support group activities. All of this activity is funded primarily through contributed income, so we demonstrate stewardship of donor investment through grant reports and our annual report to all donors. We consistently spend over 85% of our operating costs on programs and services. Because AAN works between agencies on behalf of children and families, there are times when caseworkers and families don't see our work. It reminds me of the old BASF commercial. We don't make the products, we make the products better. In our case, we do not take custody of the child, and we may not be the social work agency who conducts the family's home study assessment, but it is AAN that makes the connections possible for the child or the sibling group to be matched with a family. The matches simply would not happen if it weren't for our staff and our processes. Adopt America was founded by Dick Ransom, the same man who founded Hickory Farms. Mr. Ransom began the work as a charitable endeavor, and we continue to rely on 85% of our funding from contributions from individuals, foundations, and fundraising. Most private agencies charge fees to families, or they require the family to adopt a child from a state that has enough placement contract money to cover the agency costs. As a charity, it is our passion and our mission to provide services to families who are willing to adopt special needs children from foster care without charging fees. Since 1983, Adopt America has directly assisted in the placement of 4,000 children with special needs from U.S. foster care. These children are some of the most challenging children to place because of the medical or emotional issues, their age, or because they want to be placed with one or more brothers or sisters. We consistently experience a low rate of disrupted adoptive placements at 5%, compared to reported national averages of 15 to 20% for children with special needs. As AAN's president, I was elected to a 4-year term as chairman of the board of Voice for Adoption, the national advocacy organization for adoption headquartered in Washington, D.C. And finally, AAN participated in the White House Office of Faith-Based and Community Initiatives Roundtable on faith and community solutions for orphans and vulnerable children. Prior to the recession in the mid-2000s, Adopt America was placing an average of 200 children per year. Unfortunately, a combination of reduced foundation funding and individual giving made it necessary for us to reduce our workforce. No challenge is so great as to divert AAN from our mission. We know anecdotally that our families are economically modest. We want to help the families adopt the kids, but we can't do our work for free. The government funds public institutions based on how many children they have in their care. Family servicing agencies like AAN are not in the funding equation. Recent statistics demonstrate that 50% of the children in foster care have medical challenges, and 70% have siblings. Mental health statistics are less available, likely due to the broad range of diagnosed and undiagnosed disorders. We do know that some states report 25% of children adopted from foster care suffer from post-traumatic stress disorder, nearly double the rate of war veterans. With additional sustained funding, AAN would expand our adoption services programming to recruit, to train, match, and support families who adopt children with special needs from foster care. We'd offer our training and matching services to more jurisdictions to result in more placements. And with additional resources, AAN would like to develop and implement a training program that we could take from place to place, launching a whole new opportunity to match children with families. Families are being recruited through media efforts and at events across the country. They're either provided with a publicly funded home study assessment or they pay for a private one so that they can get it done more quickly and be considered for children from outside of their own state. AAN has the experience and the model in place to help these families move forward in their desire to adopt. The families are a vital resource for waiting children. It is our desire to help these families throughout their adoption journey. The result will be more children going home. We'd also like to reach out to overburdened public systems, offering to help them match their children with families. But they have little or no resources to contract with us or reimburse us for our work. With adequate funding, AAN could do so much more to ensure that all children have a place to call home. Thank you for your interest in our very important work.